Hi, my name is Roger Worthington. This message is for Secretary Robert McDonald of the U.S. Department of Veterans Affairs. Secretary McDonald, I'm a lawyer. I've been representing men and women stricken with asbestos cancers like mesothelioma for the past 25 years. It's truly been a privilege and an honor to represent some of the finest Americans, the folks who built this country, who built our hospitals, our schools, our churches, the homes we live in, and also the brave men and women who put their lives on the line to defend this country, who fought our wars, and during the process of fighting those wars inhaled asbestos while aboard Navy ships. Secretary McDonald, I have some good news and then some bad news. The good news is, here in Los Angeles, about a year and a half ago, Dr. Dean Norman, who's the Chief of Staff at the West LA VA, and Dr. Robert Cameron, who's a world-renowned thoracic surgeon, they created a program designed to help veterans with mesothelioma. They called it the Comprehensive Meso Center. The center is designed to provide first-class, world-class treatment to veterans from all over the country, regardless of where they reside, whether they're in Buffalo or Miami or Seattle or Detroit or Houston. They're all eligible within the network to be treated here in Los Angeles. The good news is Dr. Cameron is one heck of a good surgeon, and he is surrounded by some of the finest oncologists and radiologists and benchwork scientists from all over the world, great nursing staff. These folks are trained professionals, they're experienced, and they're eager to treat veterans. They have a very ambitious plan to engage in world-class clinical trials. They're eager to engage in benchmark research on immunotherapies and gene therapies, stem cell research, cryoablation. They have all the manpower and womanpower and muscle it takes to tackle this horrible asbestos-related cancer. They're ready and willing and eager to start treating veterans. It's been a year and a half. Now here's the bad news. The bad news is nobody knows about it, or very few people know about it. The VA has not done a good job at all in letting veterans know that the program exists. They haven't even notified the doctors within the vast VA network about the existence of the Comprehensive Meso Center in Los Angeles. As a result, very few people know about it, and therefore they're not getting treated. Dr. Robert Cameron is an incredibly talented thoracic surgeon. He's also a scientist, and he's assembled a stellar team of scientists and doctors, radiologists, oncologists, and nurses to assist him in providing world-class treatment for veterans with mesothelioma. Dr. Cameron has put together a very ambitious agenda for conducting benchwork research on mesothelioma, also for conducting multimodal clinical trials for mesothelioma, as well as engaging in basic treatment under the therapies that are currently available. More good news, this will be a model program. It will allow doctors at the West LA VA, using modern technologies like telehealth and telemedicine, to review records, to engage in the diagnosis, to treat patients, and also follow up with them regardless of where they live. This program also comes with a very small price tag, and the VA annual budget is around $165 billion. Dr. Cameron has proposed a budget of between $5 and $10 million. And by the way, the benefits of that program will accrue to all patients diagnosed with mesothelioma, including civilians. And civilians need help too. In this country, roughly 4,000 Americans are diagnosed annually with malignant mesothelioma, and about a third of those are Navy veterans who got their exposure working in shipyards or on Navy ships. But civilians too need help. There isn't really a comprehensive meso center in this country, and there really isn't a lot of hope. So the VA program will not only treat veterans with meso, but the benefits of that program will spill over to help all patients in this country diagnosed with meso. So that's the good news. The good news is the program has been created. It's in Los Angeles, and there are talented doctors and nurses who are standing by to treat veterans. Now for the bad news. The bad news is Very few patients, very few veterans know about the program. Very few doctors within the VA network know about the program. And for those veterans who stumble upon the existence of the program, there are insufficient funds to reimburse those patients for traveling to the center. The problem really is the VA hasn't publicized the program. It's not on their website. They haven't used social media at all to promote the program. So as a consequence, there's no waiting list because nobody knows about it. Secretary McDonald, you've inherited something of a mess. We've all read about the waiting lists down in Phoenix and veterans dying while waiting to be treated. That's horrible and that's tragic. I read reports from you where you've talked admirably about replacing a culture of apathy with one of respect and care and integrity. You've talked about rebuilding trust with veterans, providing specialized care, getting better outcomes. Secretary McDonald, this is an easy one. You can do this. This is an easy fix. The program's already there. All you need to do is educate your doctors and educate our veterans about the program. And then you need to fund it meaningfully so that it has a chance to succeed. And more good news. Name the program after Admiral Elmo Zumwalt. Elmo Zumwalt was one of our nation's finest officers. He himself, Admiral Zumwalt, a sailor, well loved by all, died of malignant mesothelioma himself in 2001. His family has agreed to let the government use their name to promote and identify the program. Call it the Admiral Zumwalt Mesothelioma Center of Excellence. Secretary McDonald, the time for the VA to step up and help those veterans exposed to asbestos in the line of duty is long overdue. The federal government has known about mesothelioma for at least 50 years. We are simply asking the VA to fulfill its duty to those brave men and women who put their lives on the line defending our country on Navy ships and were poisoned by asbestos while serving their country. You can do this, Secretary McDonald. Thank you for your attention.